Good evening, ladies and gentlemen. I'm opening the last session of today's program. The title that we are going to discuss, first to hear the presentation and then discuss, is The Privatization of Social Services, Health and Welfare in the Turkish Case. There are two colleagues here to make their presentations. The first colleague is Dr. Burcu Yakut Çakar, sitting just next to me. She is an associate professor of labor economics at Kocaeli University, and she is also working for Boğaziçi University as a part-time professor. Her interests lies in the intersection of social policy and political economy. She's actively interested in economics of social policy, many areas including public policy, female employment, gender budgeting, etc., pension reforms, etc. She's a member of UK Social Policy, United Kingdom Social Policy Association, International Association for Feminist Economists. She's also a member of these associations. She has written various articles, journal articles, on different journals, both in Turkish and English. The other colleague who is going to give his presentation to us is Professor Kayıhan Parla. He's a professor at Uludağ University, where he graduated in 1988. He's the author of over about 90 papers, 22 of them are international. And all the papers are on public health because the colleague is a doctor himself. He holds 3 important awards. He has close relations with medical associations. He is also still the member of Turkish Medical Association. Now, the floor is for our speakers, or you, Orat. So, Dr. Kayıhan Parla is going to make his presentation as the first speaker. Please, go ahead. The floor is yours.
As in committee to invite me here. I try to show neoliberal health reform story shortly in my country. I will discuss milestones of neoliberal health reforms in our country and assessment of the reforms in terms of social partners, community, health manpower, and of course, global capital. In January 1980, neoliberal era began in a country, and as you know, same year, the neoliberal policies were settled by military coup. After the military coup, 2 years, we had a new constitution, and state's mission changed related with health. State plans and organize all health institutions. You cannot see any delivery of service and related with health in new constitution. 1983 between and 2002, government's various initiatives to support private sector. The basic one is health services basic law. Marketization of public health institutions and precarious employment for health manpower cancelled by Constitutional Court in 1988. But then, in 2003, government launched health transformation program. It was given a new name for neoliberal health policies. According to Minister of Health, health transformation program aims in the framework of 8 main themes. First one is Minister of Health as the planner and supervisor only. There is no any delivery of health services. Second, universal health insurance, gathering everyone under single umbrella, and then a kind of privatization of primary health care, physician health system and family medicine, etc. In June 2002, a report published by World Bank in Turkish that called Turkey Reforming the Health Sector for Improved Access and Efficiency. I think it was the first report published in Turkish by World Bank. English version was published in March 2003. And 1 year later, government launched Health Transformation Program in July 2003. World Bank said in this report, major reforms are essential. What kind of major reforms are essential? World Bank's health reform strategy for Turkey has 5 components. First one is universal coverage, of course, with social health insurance. Secondly, essential package, you can call basic package for insurance system. Reorganizing public hospitals and providing greater autonomy. Consolidating and redefining institutional responsibilities, especially for 2 ministries, Ministry of Labor and Social Security and Ministry of Health. And the last one was strengthening delivery of primary care services. Yeah, it was a big debate between Ministry of Health and us. Really, who is the owner of Health Transformation Program? Our minister said, we have. But then in 2012, WHO announced the real owner of HTP, the Health Transformation Program, a health system reform program funded by the World Bank. And it is finished the debate. After the implementation of this program, social security organizations were combined and social security institution was established in 2006. In the same year, social health insurance was introduced, of course, with premium, user fee, and basic package. Ministry of Labor and Social Security's hospitals were transferred into the Ministry of Health, and social security institution began to purchase healthcare services from public or private institutions. Of course, complementary private insurance was established in 2012. The Ministry of Health administrative structure has changed. Maybe it was important components of our reform. Minister was withdrawn service delivery. Basically, public hospitals, institution of Turkey, you can call hospital unions like HMO, a kind of HMO, was established as a subsidiary of the ministry. And then public hospitals managed by CEOs. In the primary care, public health centers were closed instead of family health centers were opened in 2010. We talked about a type of private outpatient clinic, a personalist-based family medicine model, on average approximately 3,500 people are registered to each center. Payment model for physicians, basically capitation. Expenses, rent, electricity, clinic, etc., are met by physicians. As you know, Turkey, average people registered into each family medicine center, 3,621. It is different in Istanbul or northern Anatolia. And it was interesting things changed. Numerous medical faculties were opened. 2002, we have 50. Last week, we have 67, but I'm not sure today we have. Employment method was changed for health manpower. Transition from civil servant to subcontracted worker. For physicians, especially who worked in public sector, GP transition from salary to capitation. Specialists who worked in public hospitals, salary plus performance-based supplementary payment system, but you can call fee-for-services system because it is not related only performance-based. Yeah, we can assess now of the neoliberal health reforms in terms of social partners. There are too much component of assessment of the reforms in terms of community. Access to care, quality of care, equity, long healthy lives, patient satisfaction, efficiency, health expenditures. But as you know, I have limited time. Because of this, I show you some figures and I addressed some issues. Maybe we can discuss in discussion section. Most important thing is universal coverage. According to official data by Social Security Institution, as you know, 2013, over 18% people rate of unregistered insured population. We can estimate approximately 30.8 million people out of this system. According to Social Security Institution, person whose general health insurance premiums paid by state, approximately 7.6 million. How about others? We can talk about approximately 6.2 million people. Plus, there's some people has in coverage, but there is no access to health care because of debt. According to official data, over 5 million people who have not access to health care because of their debt. Overall, we can estimate over 15% of people is not coverage in the system. But 10 years ago, a paper published in New England Journal of Medicine, as you know, as you see, health insurance rate in population, 98%. It is not true. And Harvard School of Public Health announced this paper, the sample of other middle-income countries. But really, universal coverage rate is not true. We know that there were over 11 million people in Turkey not covered by any insurance scheme. I will send a letter to editor next week in this issue. We have a big problem related with neoliberal health reforms in our country because statistics are distorted for propaganda by Ministry of Health. One example. Maybe you know, a paper published in Lancet 2 years ago. Please look at authors. First author, Rıfat Atun, same that one. And the last author, Recep Akta. You know this? He was former Minister of Health. And look at, please. In this paper, they claim that infant mortality rate in Turkey 7.7 per 1,000 live births. 2 years ago. But 10 days ago, Rıfat Atun, in his paper, announced the new infant mortality rate as 17 per 1,000. Which one is true? Other problem is, I think you don't have a similar problem in Israel. Increasing admissions to emergency services. Last year, more than 104 million admissions to emergency service in our country. Do you believe me? Because I cannot believe this data. With health transformation program, our country is now the only country where the number of emergency admissions exceeds the total population. Our total population is only 78 million. We are the only one country in all over the world. And we have additional problems with user fee. As a co-payment, you should pay too much money if you access to healthcare, if you are insured people. For example, outpatient medical examinations, family health centers, 2 Turkish liras, public hospitals, Union 5, etc. I think there's a problem with. Yeah. You know, compare with 2009, 2012, user fee for medical examination rate has increased to 18%. But we don't know what is the rate of medicine for user fee or informal payment to private sector, because there is no any data that published. Quality of care is other problem. For example, mortality within 30 days of hospital admissions for acute myocardial infarction in our country is 35% higher than the OECD average. Similarly, the stroke. Admission rate for uncontrolled diabetes is a clear outlier at nearly 10 times the OECD average. Quality of primary care is similar. For example, cancer screening rates are very low if you compare with OECD countries. Efficiency is other problem. For example, bed occupation rate. In our hospitals is only 64.9%, the third lowest degree in the OECD countries. The number of cesarean sections in Turkey are the highest among OECD countries. Chronic obstructive pulmonary disease admission rate is over 4 times. Yeah, as you see, Ministry of Health, university hospitals, and private sectors, bed occupation rate are. But I know that the highest rate in your country, Israel, but we have some problems, I know. But our occupation rate is really low. Yeah. Maybe. Yeah. In accordance to health economics, it is the optimal rate over 75%, maybe 80s. In our country, neoliberal health reforms have changed the financial structure of public hospitals. While the share of general budget has gradually decreased, the share of extra budgetary sources such as health insurance has increased. This change in financial structure has eliminated the public nature of hospitals. Then, depending on this change, revolving fund has been a dominant financial tool in hospital unions. The change in financial structure of public hospitals have led to many changes in patient care. For example, hospitalization period has reduced. Long-term care services began to be transferred out of hospital. And many services in hospitals, hospitality, home care, pathology, and other laboratory services, kitchen, cleaning, etc., are purchased externally. You can see 2002 and the 2002 2013. Public hospitals, university hospitals, and private hospitals. Yeah. In our country, average length of stay, 4 days. In your country, 6.5. And then, crude death rate was changed. As you see, especially in private hospitals, increased from 9.6 in 2002 and 2013, 14.7. The health transformation program has not provided a significant improvement in community health indicators. Today, Turkey is far behind the developed countries in public health indicators. 3 examples. First one is life expectancy. Second, infant mortality rate. And the third one, unmet healthcare needs. As you see, Turkey rate is very high. Second group is health manpower. Assessment of the reforms in terms of health manpower has various components: employment status, employee rights, working conditions, especially violence on health sector, workload. In my country, over 80 patients per day for physicians. It is unbelievable number. Exposure assessment, income, and of course, worker satisfaction. Maybe you cannot see this table, but I can explain it quickly. In 2002, total number of visits to a physician only over 200 million. Nowadays, over 630 million. Because of this, total number of per capita visits of physician 30.1 to increase 80.2. Basic issues related with health manpower, assurance of life, assurance of employment, assurance of regular income, and professional independence. Violence in the health workplace is the basic issues for us. For example, in 2 years, over 23,000 cases, average 30 cases per day. 2 physicians, our colleagues, were killed last year. Outsourced employment is growing, as you see. Weekly working hours, unbelievable, especially resident and specialist must work in a week over 60 or 70 hours. And the last one is, we can assess of the reforms in terms of global capital. Especially, we should talk about profit maximization. Purchasing of services in public system, outsourcing, and purchasing of healthcare from private hospitals. Increase in demand, more patients, more tests, more imaging methods, more medicines, more surgery, monopolization, and of course, privatization. You can see outsourcing trend. Today, all public hospitals are using outsourcing. Before the 1980s, this rate was 0. The distribution of outsourced services, both non-clinic and clinic, magnetic resonance, computerized tomography, etc. Social health expenditures, private sector more expensive, you know. And twofold increase, the money transferred to private hospitals by social security institutions by the way of this reform. Private hospitals, twofold increase last 10 years. Growth rate over 200%. Fourfold increase in actively used hemodialysis in private sector. And MRI growth rate over 1,200%. Yeah. If you can compare, for example, Israel and Turkey number of MRI devices, you know, Turkey 10.4, Israel only 3 point. Maybe you cannot believe this data because we talked about more surgical operations. In 2002, we have only 2 million surgical operations. Nowadays, over 14 million, sevenfold increase we talked about. Yeah, in our country, over 9 million MRI, over 11 million CT, over 24 million ultrasound, etc. In 2003, 769 million bucks sold medicine, and today, threefold high. Expenditure, you can see private health expenditure in 2002 and now. I have no time because of hurry. Yeah. 2003, out-of-pocket expenditure per capita by years only, as you see, $87, but nowadays $151. Privatization process of public hospitals, public-private partnership in Turkey. Sorry. Current trends by the World Bank directives, as you see, new public management, extreme component of marketization of public hospitals in our country by the way of PPP. But in our country, they called city hospitals. It's a nice name, both city and hospitals, but it's not nice institution. Because a huge new sources is transferred to global capital with state hospitals using public name. From the international company point of view, it is commercial solution. The privatization of trials, maybe we can call. The public sector enters in the long-term contracts over 25 years with private sector companies to design, build, finance, and operate, especially non-core services, a new hospital. Cost more expensive, as you see, PPP Kayseri Hospital cost. As a result, in the aftermath of neoliberal health reforms, we have to answer this question. Who gains, who loses, in point of view of community, health manpower, global capital? I try to give my short answers. Thank you very much.